Podcast 12B, Myopia Reduction Training. If you have any questions or would like any additional information, please do not hesitate to contact me. The goals of this podcast are a review of previous podcasts dealing with nearsightedness, myopia. Secondly, what are the techniques for myopia reduction training? And thirdly, an assignment to help you generalize the content of the podcast into your everyday experience to improve your vision. The most critical factor in reducing nearsightedness is to get out of the habit of concentrating in the center of the visual field. This requires a substantial effort to change your lifestyle. Furthermore, I have not seen in any literature any law or dictum that requires that we see everything clearly at every distance. In fact, people who have excellent vision and do not require any type of glasses or contact lenses will only see clearly the object that they're looking at. Those objects that are in front of or behind that object will be slightly blurry. This is known as the depth of field, which may be familiar to those who have interest in cameras. One of the first cases of a successful nearsightedness reduction training was presented in 1982. The table and chart on the left show a dramatic improvement in unaided visual acuity from 2400 to 2020. What does 2400 mean? It means that someone with normal vision can see at 400 feet. This person would have to walk up to 20 feet to see the same letter on the eye chart. The table and chart on the right show the reduction in myopia in focusing units diopters from 3.5 to 1 in the right eye and from 3.5 to a half a diopter in the left eye. The amount of time for this successful training was about 4 months, with follow-up a year later showing the maintenance of the improvement. In 1999, we published an extensive report of 1,344 people who had received the training. The graph in red is for the right eyes, and the graph in green is for the left eyes. Both graphs show an average reduction of myopia of about 1.5 diopters, with a maximum decrease of 7.5 diopters. To my knowledge, this is the most extensive report of successful myopia reduction to date. Slide 7 is a review of the podcast on parallel processing that you may want to take a look at to get a fuller understanding of the concepts of central and peripheral vision. We now come to discuss how we achieve such dramatic results in myopia reduction and vision improvement. As mentioned earlier in the previous podcast, vision is a brain function. When we can train the brain to be in a dominant alpha wave pattern, as discussed in the Alpha Brainwave podcast, all the functions of vision in the eye and brain are optimized. This is produced by our biofeedback training or neurotherapy, and especially with our newest training instrument, the Zone-Trac Ultimate Reality. The instrument measures our focusing and concentration at the same time and convert that to an auditory tone and then to a spinning image on a computer screen or to an oscilloscope display. Results of the improvement are almost immediate, with most patients being able to notice a significant improvement in the vision after the first training session. Sometimes we employ other types of biofeedback instruments, such as brainwave biofeedback, muscle biofeedback, and temperature biofeedback. The training program is customized to the needs of each individual patient. Patients are also encouraged to do diaphragm breathing, particularly when reading or using a computer or smartphone. The reason most nearsighted people tend to be shallow chest breathers, and this becomes exacerbated the longer they look at doing their close work. Sometimes we'll use TENS units, which is transcutaneous electrical nerve stimulation, to relax certain muscles that are resistant to other methods of relaxation. Progressive relaxation is an effective method to teach people how to get relaxed. For more information, you can do a search on Jacobson's progressive relaxation technique, and you can practice this on your own. In my opinion, the best way to relax and balance the nervous system is by aerobic exercises, whether it be by walking, running, swimming, yoga, or ballet. As mentioned in the previous podcast, the distance that we read and the angle that we hold the reading material is very important. For more information on that, you can go back to podcast 12A. Here are 3 exercises that, when done diligently, will drastically improve your peripheral vision and make you more aware of how much you are misusing your central vision.